Let's review. Pediatrics. Our category for this video is 100 Most Common According to Nelson's. Are you ready? Good luck! Most common cause of hospitalization for children 1 to 9 years of age. Respiratory illness. Most common cause of admission for adolescents. Mental illness. Most common cause of death in infants 1 month to 1 year. Motor vehicle accidents. Most common cause of severe visual impairment in children. Retinopathy of prematurity. Most common presentation of mild to moderate visual impairment in children. Nearsightedness. Most common cause of mild to moderate hearing loss in children. Acute and chronic otitis media. Most common form of cerebral palsy. Spastic cerebral palsy. Most common sequela of suboptimal sleep. Daytime sleepiness. Most common form of child maltreatment. Neglect. Most common perpetrators of physical assault on youth. Peers and siblings. Most common genetic cause of obesity. Melanocortin 4 receptor gene mutation. Most common and concentrated source of calcium. Dairy products. Most common indication for long-term parenteral nutrition. Short bowel syndrome. Most common cause of catheter-related sepsis. Coagulase-negative staphylococci. Most common cause of metabolic acidosis in hospitalized children. Diarrhea. Most common presenting complaint in distal renal tubular necrosis. Failure to thrive. Most common genetic disorder resulting to Fanconi syndrome in children. Cystinosis. Most common cause of metabolic alkalosis. Emesis. Most common cause of acute deterioration in children. Respiratory failure. Most common chronic condition among children. Asthma. Most common cause of shock in children. Acute hypovolemia. Most common type of distributive shock in children. Septic shock. Most common type of fatal injury among infants. Suffocation. Most common cause of fatal injury among children ages 1 to 4 years. Drowning. Most common type of DNA mutations that cause disease. Point mutation. Let's take a break. Skill is only developed by hours and hours of work. Usain Bolt. Back to the test. Most common skeletal dysplasia in humans. Achondroplasia. Most common cause of inherited intellectual disability. Fragile X syndrome. Most common chromosomal abnormality in spontaneous abortions. Turner syndrome. Most common abnormality of chromosomal number in live-born infants. Down syndrome. Most common Robertsonian translocation leading to Down syndrome. Chromosomes 14 and 21. Most common Robertsonian translocation leading to trisomy 13 or Patau syndrome. Chromosomes 13 and 14. Most common genetic cause of hypogonadism and infertility in men. Klinefelter syndrome. Most common mosaicism in Klinefelter syndrome. (46XY/47XXY). Most common congenital heart defect in Turner syndrome. Bicuspid aortic valve. Most common congenital heart defect in Williams syndrome. Supravalvular aortic stenosis. Most common inborn error of beta oxidation. Medium chain acyl-CoA dehydrogenase deficiency. Most common brachial plexus injury. Herb Duchenne paralysis. Most common cause of neonatal hyperbilirubinemia requiring therapy. ABO incompatibility. Most common intestinal emergency occurring in preterm infants admitted to the neonatal intensive care unit. Necrotizing enterocolitis. Most common transmission of congenital syphilis. Transplacental infection of the fetus. Most common reportable sexually transmitted infection. Chlamydia trachomatis. Most commonly infected anatomic site for chlamydia trachomatis in infants. Nasopharynx. Most common etiology of abnormal uterine bleeding in adolescents. Physiologic anovulation. Most common gynecologic complaint of young women. Dysmenorrhea. Most common cause for young women to drop out of school. Pregnancy. Most common side effect of etonogestrel implant. Irregular bleeding. Most common form of hyper-IgM syndrome. X-linked hyper-IgM syndrome. Most common cause of severe combined immunodeficiency. X-linked severe combined immunodeficiency. Most common form of hyper-IgE syndrome. Autosomal dominant hyper-IgE syndrome. Most common form of non-allergic rhinitis in children. Infectious rhinitis. Let's take a break. The successful warrior is the average man with laser-like focus. Bruce Lee. Back to the test. Most common anatomic problem causing nasal obstruction in young children. Adenoidal hypertrophy. Most common adverse effect of first-generation antihistamines. Sedation. Most common cause of food-induced eczematous reaction. Egg allergy. Most common physical urticaria. Dermatographism. Most common systemic vasculitis of childhood. IgA vasculitis. Most common chronic rheumatologic disease of childhood. Juvenile idiopathic arthritis. Most common form of juvenile idiopathic arthritis. Oligoarticular juvenile idiopathic arthritis. Most common joint involved in oligoarticular juvenile idiopathic arthritis. Knee. Most common complication of juvenile idiopathic arthritis. uveitis. Most common complication of juvenile dermatomyositis. Calcinosis. Most commonly identified serious bacterial infection in children younger than 3 years of age. Urinary tract infection. Most common cause of fever of unknown origin or FUO in children. Infections. Most common complication of measles infection. Otitis media. Most common sexually transmitted infection. Condylomata acuminata. Most common regional lymphadenitis among children. Cervical lymphadenitis. Most common manifestation of toxoplasmosis. Asymptomatic cervical lymphadenopathy. Most common cause of human disease. Upper respiratory tract infection. Most common virus associated with the common colds. Rhinovirus. Most common complication of upper respiratory tract infection. Otitis media. Most common infectious agent causing pharyngitis. Viruses. Most common bacterial agent causing pharyngitis. Streptococcus pyogenes. Most common bacterial pathogen causing otitis externa, especially in association with swimming in pools. Pseudomonas aeruginosa. Most common infection of the middle respiratory tract. Croup. Most common cause of croup. Parainfluenza viruses. Most common cause of bacterial tracheitis. Staphylococcus aureus. Let's take a break. Testmanship tips. If two answers are opposite, one is probably correct. Adapted from Study Skills and Test-Taking Strategies for Medical Students by Deborah D. Shane. Most common complication of croup. Viral pneumonia. Most common bacterial cause of pneumonia. Streptococcus pneumoniae. Most common cause of diarrhea in children globally. Viral gastroenteritis. Most common cause of outbreaks of acute gastroenteritis. Norovirus. Most common cause of acute viral hepatitis. Hepatitis A virus. Most common gynecologic problem in prepubertal girls. Vulvovaginitis. Most common cause of vaginitis in postpubertal females. Bacterial vaginosis. Most common cause of vulvovaginitis in prepubertal females. Nonspecific vaginitis. Most common manifestation of osteomyelitis in children. Acute hematogenous osteomyelitis. Most common cause of chronic osteomyelitis. Staphylococcus aureus. Most common cause of viral conjunctivitis. Adenoviruses. Most common cause of all fungal infections associated with childhood cancer. Candida species. Most common presenting symptom of serious infection in cancer and transplant patients. Fever. Most common pathogen causing peritonitis from indwelling catheters used for peritoneal dialysis. Skin flora. Most common tick-borne infection in the United States. Lyme disease. Most common vector for plague in the United States. Orpsilla montana flea. Most common transmission of salmonellosis. Fecal oral. Most common rickettsial illness in the United States. Rocky Mountain spotted fever. Most common skeletal site for tuberculosis. Spine or pot disease. Most common infectious cause of aseptic meningitis and encephalitis. Viruses. Most common cause of native valve endocarditis in children. Streptococcus. Most common cause of prosthetic valve endocarditis in children. Staphylococcus. Most common bacterial cause of septic arthritis. Staphylococcus aureus. Most common diagnosis of constipation in older children. Functional constipation. Most common allergen associated with eosinophilic esophagitis. Cow's milk. How did you do? If you find this video useful, consider giving this video a like. Your support greatly helps this channel. Remember to click the subscribe button so you will be updated of future review videos like this. Study hard, and see you on the next review video.